The SRHR Alliance in Kenya is a coalition of 17 civil society organizations and institutions working to promote the sexual reproductive health and rights of young people, women, and marginalized groups. The alliance was first established in the Netherlands in 2010 with support from the Dutch Ministry of Foreign Affairs through international partners comprising of Rutgers, Simavi, Amref Flying Doctors, Choice for Youth and Sexuality, Dance for Life, Child Helpline International, International Planned Parenthood Federation, IPPF, and Stop AIDS Now. It implements two main programs, namely Unite for Body Rights Program, UFBR, and Access Services and Knowledge Program, across 11 countries, 7 in Africa and 4 in Asia. Our local partner organizations include Amref Health Africa, Africa Alive, ACK Development Services Nyanza, Center for the Study of Adolescents, Clinton Health Access Initiative, Childline Kenya, Family Health Options Kenya, Great Lakes University of Kisumu, KMET, Maximizing Facts on AIDS, Nairobi's Trust, Network for Adolescents and Youth of Africa, National Empowerment Network of People Living with HIV/AIDS in Kenya, Support Activities in Poverty Eradication and Health, World Starts With Me Alumni Youth Advocacy Network, Women Fighting AIDS in Kenya, and UNESCO. As an alliance, we thrive in building synergies and collaborating with like-minded organizations and stakeholders. We are guided by the following 3 main objectives. 1. To increase access to comprehensive sexuality education and sexual and reproductive health information among young people. 2. To increase demand for and access to quality sexual and reproductive health services. 3. To create an enabling environment for the realization of the sexual and reproductive health and rights of young people, women, and the marginalized. These objectives are anchored in a theory of change which presupposes that by empowering young people and women of reproductive age with appropriate SRHR information, their health-seeking behavior will improve, eventually translating to increased uptake of SRHR services. It, however, underscores the importance of an enabling social and policy environment in the provision of SRHR information and services. Since its inception, the Alliance has made significant progress in contributing towards better health outcomes among young people, women, and marginalized groups. We have so far reached 2,295,698 young people of the ages of 10 to 24 years in and out of school with comprehensive sexuality education across 15 counties, namely Nairobi, Mombasa, Kisumu, Kwale, Kilifi, Homa Bay, Siaya, Migori, Kisii, Busia, Kakamega, Bungoma, Uasin Gishu, Trans Nzoia, and Kajiado. This has been achieved through a mix of innovative approaches including teacher-driven curricula, example, World Starts With Me, peer education through innovative ways like newspaper pullouts and board games, digital platforms like www.youthforlife.co.ke, mass media, edutainment, IEC materials, helplines, telemedicine. We have also managed to reach 505,658 women and men with sexual reproductive health information. In addition, 1,683,860 community members and leaders have been engaged with the aim of creating a supportive SRHR environment. Regarding access to SRHR services, we have trained 21,141 healthcare providers on essential aspects of service provision, including youth-friendly services, commodity supply management, and basic emergency obstetric care, BEMOC. We have supported the establishment of youth-friendly centers in 28 health facilities and supported the setting up and strengthening of community health units. As a result, 8,120,642 young men and women of reproductive age have been able to access SRH services, including commodities, in the counties of operation. We have also managed to implement a community-led alternative rites of passage model in Kajiado County that has significantly contributed to the fight against FGM. On the policy front, we have utilized our comparative strengths to inform different policy discourses, including, but not limited to, the review and development of the Adolescent Sexual Reproductive Health Policy, the development of guidelines on comprehensive sexuality education, the formulation of the Kenya AIDS Strategic Framework, county budget processes for reproductive health, ICPD beyond 2014 and post-2015 agenda. While progress has been made over the 4 years, a lot of ground is yet to be covered. Statistics indicate that knowledge levels among young people on HIV prevention and treatment is still very low, with only 17.4% of young people between the ages of 10 to 14 years having correct knowledge. 30% of new HIV infections and 17% of AIDS-related deaths occur among young people below 24 years. Teenage pregnancy currently stands at 18% among teenagers of 15 to 19 years, with the situation remaining unchanged since 2009. The national coverage of facilities offering youth-friendly services stands at 10%. Contraceptive prevalence rate is 58%, with the situation being worse, 18% among uneducated women. 58% of women attend at least 4 ANC visits. 62% of births are attended by a skilled provider, while 61% of births take place in a health facility. In light of the challenges highlighted, today we launch an ambitious 5-year strategy that seeks to harness partnerships to promote the realization of sexual reproductive health and rights of young people, women, and marginalized groups. We intend to consolidate the experiences, lessons, best practices, and the gains we have made since inception to scale up our interventions on sexual and reproductive health among our key constituency, who are largely young people and women of reproductive age. The following are the key priority areas of intervention that we intend to focus on over the next 5 years. 1. Advocacy for better SRHR environment. The Alliance will create a platform for civil society organizations in and out of its membership to influence the SRHR agenda and policies at county, national, and international levels. We will advocate for enhanced access to SRH information, services, and commodities, especially among marginalized and vulnerable populations such as adolescents. We will strive to ensure that the primary healthcare system has essential SRH package, including youth-friendly services. We will advocate for inclusion of SRHR in poverty education, post-MDGs, and other development frameworks. We will strive for increased budgetary allocation for SRHR at the national and county levels. We will also monitor the implementation of existing SRHR policies, including regional and international commitments. Capacity strengthening of partner organizations. The Alliance will implement interventions to strengthen the capacity of partners to increase demand for SRH, deliver effective programs, and effectively undertake advocacy. We will support institutional capacity building of partners to undertake research and effective evidence-based programming on key SRHR thematic areas. We will strengthen the capacity of partners to improve health systems and deliver SRH information and services to young people, women, and the marginalized. We will also strengthen the capacity of partners to integrate ICT use in SRHR programming. In addition, the Alliance will create platforms for shared learning among partners in and out of the Alliance. 3. Programming for improved SRH status of young people, women, and marginalized groups. The Alliance will leverage on the comparative strengths of its partners to design and jointly implement interventions aimed at improving the SRH status of its target population. We will seek to increase demand, uptake, and utilization of SRH services, including family planning, skill delivery, ANC, and HIV treatment through campaigns at the community level. We will strengthen the capacity of health systems to deliver SRH services to young people, women, and marginalized groups by supporting capacity development of human resources for health, supporting commodity supply management, and strengthening the referral system. We will seek to increase the capacity of young people, women, and marginalized groups to make informed decisions and choices by supporting the integration of CSE into the curriculum, delivering CSE to young people using E&M applications like the Youth for Life platform, and most importantly, parents. We will also seek to integrate SGBV, FGM, and HIV prevention management and care into broader SRH programming by supporting upscaling of successful models to fight FGM and SGBV using a human rights-based approach to engage communities to act collectively to renounce the practice, supporting the domestication of existing laws on FGM, generating evidence base on FGM to support programming, support interventions to address SRHR issues affecting young people living with HIV and young women living with HIV. 4. Building the institutional capacity of the Alliance. We will strengthen the identity, visibility and governance of the Alliance. We will also seek to diversify our resource base to facilitate implementation and sustainability of the planned SRHR programs through strengthening existing partnerships and building new relations. 5. Research. The Alliance will prioritize research with a view of building an evidence base for SRHR advocacy and programming. In 2014-2015, we supported different operational research studies to establish the feasibility, viability, and effectiveness of some of the SRHR interventions and innovation. Going forward, we will partner with research institutions like universities, research centers, and professional associations to conduct research on SRH issues like gender-based violence and its links to SRH, including HIV transmission, generate the evidence base of influence policy debates on SRH, including such aspects as public expenditure tracking, cost-benefit analysis of SRH interventions and programs, and will continue to strengthen capacity of partners to conduct and publish quality SRHR research. The findings of these studies will be shared with partners and key stakeholders and published in national and international journals. This will in turn inform new strategies and interventions. It is our firm belief that this strategy will contribute immensely to the improvement of health outcomes for young people, women, and the marginalized. This will in turn ensure that the future of the next generation is secured. We therefore call upon all partners and stakeholders to support us in this journey.